my name's Alison and I've been in the dentistry for about 6 years now. It's just something I was always interested in. I was one of the people like going to the dentist when I was younger, and I really liked my dentist and her nurse. I was quite lucky to have the same ones all through my primary school, and again it was just something I was always interested in, so I decided to go and do my nursing qualification for my dental nurse. And I worked in a practice that I did my placement in. They offered me a job just when I had qualified, and I worked there for a while before coming to the Berkeley. So my last practice I worked in was a family-owned NHS practice. I'd been there for many years. Just mainly NHS would always refer out for any larger treatments, but whereas coming here to the Berkeley you can get all that done under the one roof. A big private clinic like this, you can offer implants, you've got sedation, you've got a specialist orthodontist and endodontist here, so you've got all these different range of treatments under the one roof. We've also got our labs on site as well. You've got your denture lab and you've also got your digital lab as well. So when I came to Berkeley I did start as a dental nurse, and in my training, when I was here as a dental nurse, they put me through training to allow me to work alongside implants, sedation, for Invisalign as well. We went away in courses for that, and then when I was lucky enough in my first year that they approached me with the job offer of becoming the care coordinator, which I was more than happy to take on, and they supported me with training for that as well, just to make sure that I just knew I was comfortable and confident enough to know what I was doing. Yeah, it's a great team. I feel like we're more of a family than just a dental practice. Like, we all just work here. Everybody gets on so well. We're so fond of each other and we all support each other, making sure everybody is getting on in their day if they need any help. We're very supportive that way, and it's a really good environment to work in. I think it works really well because we are so different, but everybody's just so passionate about what they do, and they want to see everybody succeed as well. So I think it's just a good mix for everybody, and we're all very patient focused as well. Everybody's main goal is to make sure their experience is that we want to give the patient the best experience, so everybody works well together to ensure that everybody's great at different things as well, which is so good. Whereas like I can support the clinical team, they'll support each other, and the nursing staff as well. The most meaningful part of my job is the fact that I am a patient's point of contact throughout their full journey here, whether it's a small treatment plan, big treatment plan. They can come to me for any help, for advice, even just from booking appointments. If there's something they don't want to discuss with the dentist, if they feel a bit silly, they know they can contact me. I've got a direct line. They can come in and meet with me to chat through their treatment plan, just to help put them at ease. And it's just great to know that I'm a help for essentially changing someone's life, because it means different to everybody else, but it's great to know that I'm a part of that. One that probably sticks out, we had a patient and he came and got full upper and lower arch reconstruction, full implants, and he was a public speaker, so he did a lot, so for him he seemed quite confident. Had a partial, quite a lot of work done, so he decided to opt for full upper and lower, and he said it genuinely changed his life, from even just being able to eat an apple. But he said it grew him in confidence in his work. All his workmates and staff and students and stuff commented how different he seemed, but even more happy, more alive, and it's just nice to know that someone that you think that wouldn't affect in that way. But yeah, and he was extremely thankful, so it was so nice to see.